Hello, I'm Dr. Ken Berry, family physician with 20 years of clinical practice. And today I want to talk with you about something that affects millions of people every single year. Something that slowly steals your ability to see clearly, to read a book, to recognize faces across a room. I'm talking about cataracts. They're the leading cause of vision loss in people over 55 worldwide. If you've been told you have early cataracts, or if you simply want to make sure you never face that diagnosis, this video is for you. The good news, and there is good news, is that there are actually 5 science-backed strategies that can potentially slash your cataract risk by 87%. Some people will see even better results. Let me start with a story that fundamentally changed how I approach this condition. I recently spoke with a patient, Harold, 78 years old from Tennessee. He's a retired farmer who spent 50 years working in the fields, dawn to dusk, under intense sun exposure. His eye doctor, a well-meaning ophthalmologist, told him his cataracts were coming because of sun exposure. Inevitable. A natural consequence of his life's work. But here's what troubled me deeply about that explanation. Harold's wife, Dorothy, spent just as many years in that same Tennessee sun. She worked alongside him in the fields. She did everything by the conventional book. Designer sunglasses. Wide-brimmed hats from specialty shops. Sunscreen. The whole protocol. Yet her eyes remained crystal clear. Still sharp at 76. No cloudiness. No vision changes. No ophthalmologist warning her about impending cataracts. So why did one person develop cataracts while the other didn't? They had identical sun exposure. They had similar genetics, being married for 53 years. Yet their lens health diverged completely. The conventional answer doesn't hold up under scrutiny. Doctors will tell you to protect your eyes from ultraviolet radiation at all times. Wear dark UV-blocking sunglasses. Get yourself a wide-brimmed hat. Avoid being out in the sun whenever possible. Spend time indoors. This is mainstream advice. But let me ask you something. Eyeballs have been exposed to direct sunlight for millions of years. Millions upon millions of years. Humans evolved under the African sun. Our ancestors worked in fields, hunted in deserts, traveled across continents in brilliant daylight. So why is it that suddenly, in the modern era, this sunlight supposedly causes rapid cataract formation? It doesn't quite make sense, does it? Here's the real problem with the conventional wisdom. No controlled research has ever proven the direct link between sun exposure and cataract formation. None. Not one randomized controlled trial. Yes, there's an association. Epidemiologists have noticed that some populations with high sun exposure have more cataracts. But epidemiological associations aren't the same as causation. Correlation is not causation. This is fundamental science. And that's the critical distinction that everyone misses. So if ultraviolet radiation isn't the root cause, what is? What's actually damaging these lenses? Well, that's where Stanford medicine researchers, Johns Hopkins scientists, Mayo Clinic ophthalmologists, and other leading institutions are now focusing their attention. And that's where the real answers lie. It's not about protecting from light. It's about understanding what actually degrades the lens at the cellular level. To understand what causes cataracts, you first need to understand the physiology of your lens. And this is absolutely fascinating stuff. Your lens is unlike any other part of your body. It's bizarre, really. It doesn't have any blood vessels feeding it. None. Zero blood supply. That means oxygen and nutrients don't arrive the way they do in every other tissue you have. Your liver has blood vessels. Your kidneys have blood vessels. Your retina, the light-sensing tissue at the back of your eye, has a rich blood supply. But your lens? It's avascular. Completely isolated from the circulatory system. Your lens cells don't have nuclei. This is strange. Unusual. Most cells in your body have a nucleus with DNA inside. Your skin cells have nuclei. Your liver cells have nuclei. Your eye's retina cells have nuclei. But lens cells don't. They lack nuclei entirely. This is a deliberate design. During development, lens cells shed their nuclei. They do this to become perfectly transparent. A nucleus would scatter light. So they sacrifice the nucleus and everything it provides. And here's something even more remarkable. They don't have mitochondria either. Think about that for a moment. Mitochondria are the power plants of cells. They generate ATP, the energy currency of life. Your muscles have thousands of mitochondria to power movement. Your brain relies heavily on mitochondria for complex thinking. Your heart has dense mitochondria to sustain constant beating. But lens cells have none. Zero. They can't generate their own energy. They're completely dependent on receiving energy from outside themselves. It's like a city without power plants, completely reliant on external electricity. Instead, your lens is entirely dependent on diffusion. Nutrients filter in through the aqueous humor, that's the clear liquid inside your eyeball surrounding your lens, and waste filters out the same way. It's a passive system. No pumps. No active transport mechanisms. Just diffusion through fluid. Do you see why this matters? Do you understand the implication? Your lens lives or dies based on the chemistry of the fluid surrounding it. Whatever is in your blood, whatever is circulating in that aqueous humor, has direct access to your lens cells. There's no barrier. There's no blood-brain barrier equivalent protecting your lens. Everything in your blood bathes your lens directly. Now, here's what physiologists and ophthalmologists know with certainty. There are 4 basic mechanisms that damage lens cells and lead to cloudiness and vision loss. First, anything that changes the shape of lens proteins will create opacity and cloudiness. This includes direct radiation, microwaves, or physical trauma to the eye itself. When proteins unfold or misfold, when their three-dimensional structure becomes distorted, light can't pass through cleanly anymore. Light scatters. Your vision becomes cloudy. It's like frosting on a window versus clear glass. Both are the same material essentially, but the structure determines transparency. Second, oxidation of those same proteins causes cloudiness. Oxidative stress is like rust forming on metal. Free radicals attack the protein structure, create cross-links, break chemical bonds. The proteins degrade. The lens becomes opaque. Third, glycation of lens proteins causes the same cloudy effect. Glycation happens when sugar molecules attach to proteins, permanently, creating new chemical bonds. It's essentially caramelizing them, like heating sugar in a pan until it browns and hardens. Glycated proteins don't function normally. They aggregate. They scatter light. Fourth, there's a small genetic component. Some people are born with inherently weaker lenses, more susceptible to these 3 mechanisms. And yes, certain genetic conditions like Down syndrome and Alport syndrome make cataracts far more likely. They're at maybe 95% risk by adulthood. But for most people, genetics accounts for only a small percentage of risk. But here's what researchers discovered that changes everything. People with diabetes, metabolic syndrome, and hypertension are much more likely to develop cataracts. The risk is 2 to 3 times higher. And I don't believe that high blood pressure directly causes cataracts. But the same underlying root causes that drive type 2 diabetes, metabolic syndrome, and hypertension also drive the oxidation and glycation of your lens. They're all connected. They're all downstream effects of the same dietary and lifestyle choices. Sugar damages everyone. Seed oils damage everyone. Smoking damages everyone. But the damage shows up in different places depending on genetics. For one person, it shows up as diabetes. For another, it shows up as hypertension. For another, it shows up as cataracts. But it's the same root cause in every case. At Stanford Medicine and other research centers, scientists are working on eye drops containing a compound called carnosine, sometimes written as N-acetylcarnosine. These drops seem to help reverse some damage by decreasing oxidation and glycation. That's genuinely impressive. Clinical results show some promise. But here's my question for you. Why would you need a medicine if you could simply prevent oxidation and glycation in the first place? Why would you rely on expensive drops if you could stop the damage before it starts? Why wait for damage to accumulate over decades and then try to fix it? Why not stop the damage before it happens? Well, actually, let me rephrase that. We should do both. We should live in a way that prevents the damage, and we should be open to emerging treatments if needed. But prevention has to come first. Prevention always comes first. It's more effective, more reliable, and it costs nothing. So let me give you the 5 tips that research suggests can reduce your cataract risk dramatically. These aren't theoretical. These are based on mechanisms we understand. These are evidence-based strategies that align with how lens physiology actually works. And here's what I find remarkable about this. There's no pharmaceutical required. There's no expensive treatment. There's no need to wait for FDA approval on new drugs. You have the tools right now. You have the knowledge right now. Everything you need to protect your vision is within your grasp today. You just need to understand what to do and commit to doing it. Let's transition to the specifics. The detailed mechanisms behind each intervention. And I want you to understand not just what to do, but why you're doing it. That understanding is what creates sustained change. Tip number 1 is straightforward but powerful. Stop smoking immediately. And here's exactly why this matters so profoundly. Research conducted at multiple institutions, including Johns Hopkins and Stanford, consistently shows that smokers have 2 to 3 times the risk of developing cataracts compared to non-smokers. That's not a small difference. That's doubling or tripling your risk. That's like living in 2 different biological universes. Why? Because every single cigarette you smoke creates acute and chronic oxidative stress throughout your entire body. Your lungs feel the free radical damage acutely. Your heart feels it. Your blood vessels feel it. Your skin cells feel it. And yes, your lens cells feel it too. They suffer from it. Smoking is essentially asking your cells to rust faster. It's accelerating oxidative aging. Every drag on a cigarette generates thousands of free radicals, unstable molecules that damage healthy tissue. Free radicals are missing electrons, so they rip electrons from your healthy cells, creating a cascade of damage. In your lens, where there's no blood supply to rush and repair machinery, where there's no inflammation response to clean up damage, those free radicals accumulate and cause lasting, permanent harm. The cloudiness builds gradually. After 20 years of smoking, your lens is significantly damaged. After 40 years, it's severely damaged. The mechanism is well established. This isn't controversial. It's basic cell biology. So if you smoke, stopping is one of the most powerful things you can do for your eye health. And honestly, it's powerful for every other part of your body too. Cardiovascular health improves. Lung function improves. Cancer risk drops dramatically. Skin quality improves. But for your eyes specifically, stopping smoking is perhaps the single most impactful action. Let me move to tip number 2, and this one surprises most people. You need to avoid corticosteroids as much as humanly possible. Now, I understand steroids are sometimes medically necessary. If you have severe inflammation, if you have an autoimmune condition, if you have COPD requiring steroid inhalers, your doctor might prescribe them. That's appropriate sometimes. That's legitimate medical use. But most people don't realize that even inhaled steroids, the ones people use for asthma, the ones that seem harmless, can increase cataract risk. It's not just steroids taken by mouth like prednisone. Inhaled steroids also have this effect on your lens. How? Well, corticosteroids suppress your immune system and affect how your body handles oxidative stress and inflammation. They also can affect blood sugar regulation, which ties directly into glycation. We see this in clinical practice. Patients on chronic steroid therapy, especially at high doses, develop cataracts at younger ages. The risk is real. The message here is simple and clear. If you're taking steroids for any reason, if you're using an inhaled corticosteroid daily, if you're taking oral prednisone, have an honest conversation with your doctor about whether you really need them. Can the condition be managed with lifestyle changes instead? Can the inflammation be addressed through diet? Can you use the steroid for the shortest time possible? Can you use the lowest effective dose? These questions matter enormously. This is education, not medical advice. Never stop taking a prescribed medication without consulting your doctor first. I want to be very clear about that. But do ask questions. Do explore alternatives. Do push back on routine prescriptions. Your lens will thank you for it. Your entire body will thank you for it. This is one of those situations where your doctor genuinely wants what's best for you, but they may not be aware of the long-term consequences of routine prescriptions. So be proactive. Be educated. Know the risks. Now let's talk about tip number 3, and this one is absolutely critical. It's the most important intervention on this entire list. You must eliminate all added sugar from your diet. All of it. Complete elimination. I mean sugar that you add yourself to coffee or tea. I mean sugar that your mother added when she baked something years ago. I mean sugar that the factory added to the processed food you're about to eat. Every bit of it has to go. Stop consuming added sugar entirely. Never drink it. Never eat it. I know that sounds extreme. But hear me out. Here's why this matters so profoundly for your lens health. Every time you consume sugar, your blood sugar spikes. Every spike means glucose molecules are circulating at high concentrations through your bloodstream. In that environment, something called glycation happens continuously. It's a chemical reaction. Glucose molecules attach to proteins in your cells, forming new covalent bonds. It's essentially caramelizing them, like heating sugar in a pan until it browns and hardens. Once that bond forms, it's permanent. The body can't easily undo it. The lens cells cannot escape this process. In fact, because the lens doesn't have a blood supply, the situation is even worse. High blood sugar in your bloodstream directly affects the aqueous humor surrounding your lens. The sugary fluid bathes your lens cells constantly throughout the day. So glycation happens faster in the lens than in many other tissues. It's like your lens is marinating in sugar water. This is the same process that damages blood vessels in diabetes. It's the same process that causes diabetic neuropathy, where nerves are destroyed. It's the same process that causes kidney damage in diabetes. And it's the same process that clouds your lens. Studies show repeatedly that people who keep their blood sugar stable throughout their lives have clearer lenses later in life. How stable? Well, research from Stanford Medicine and Johns Hopkins suggests that maintaining a fasting blood glucose below 95 mg per deciliter, and keeping your hemoglobin A1C below 5.3%, provides significant protection against cataract development. These are specific, measurable targets. Your doctor can test these. You can monitor them. You can track your progress. A1C tells you your average blood sugar over the past 3 months. Fasting glucose tells you your morning baseline. If your A1C is below 5.3%, you're in the optimal zone. If it's between 5.3 and 5.7%, you're at risk. If it's above 5.7%, you're moving into prediabetes. Many ophthalmologists don't talk about these numbers in relation to cataracts. But they should. The evidence is there. That's achievable. That's completely achievable if you stop eating added sugar and stop eating refined carbohydrates. Do that, and you're preventing the primary driver of lens damage. This is perhaps the single most important tip on this entire list. I cannot overstate its importance. Let me ask you something. Have you ever seen a clear lens in someone with very high blood sugar? Have you ever examined the lens of someone with uncontrolled diabetes and found it to be perfectly clear? I haven't. Not in 50 years of clinical practice. Not once. The association is that strong. Moving to tip number 4, you need to eliminate all grains and all starchy vegetables from your diet. Now, I know this sounds strict. I know this sounds difficult. People push back on this immediately. But hear me out. Grains include wheat, rice, oats, corn, barley, rye, and everything made from them. Bread, pasta, cereals, crackers, tortillas, bagels. All of it has to go. Starchy vegetables include potatoes, sweet potatoes, most squashes, peas, corn, and others. Here's the physiology. Here's why this matters. When you chew grains, amylase enzymes in your saliva immediately begin converting starch into sugar. This happens in your mouth. Before you even swallow. By the time the food reaches your stomach, you're already absorbing sugar. Your blood glucose rises just as sharply as if you'd drunk a soda. As if you'd eaten pure table sugar. Starchy vegetables do the same thing. They're just sugar molecules holding hands in long chains. Amylase breaks those bonds. Your digestive system breaks those bonds immediately. Within 15 to 30 minutes of eating bread or potatoes, your blood glucose has spiked. You've triggered the same glycation response as eating candy. So even though you didn't eat added sugar technically, your blood still has high sugar. The damage is identical. Glycation happens. Your lens cells are bathed in high glucose fluid. Damage accumulates. People often say to me, "But Dr. Barry, fruits are natural. Surely fruits are okay?" Yes, fruits are natural. But that doesn't mean they don't spike your blood sugar. Most modern fruits are hybridized to be much sweeter than their wild ancestors. A wild apple has a fraction of the sugar of a modern Honeycrisp. And they still cause blood sugar spikes. A single apple can raise your blood glucose by 30 to 50 points. Maybe 60 in some people. Your lens doesn't care that the glucose came from a natural source. Damage is damage. Glycation is glycation. The lens doesn't distinguish. So the strategy here is simple. Eat in a way that keeps your blood sugar stable throughout the day. That means abandoning grains and starchy vegetables. It means being selective about fruits. It means eating protein and healthy fat with every meal. When you do that, your blood sugar stays flat. It doesn't spike. Your lens cells don't get glycated. Your cataract risk plummets dramatically. You're not creating the conditions for clouding to develop. Tip number 5 focuses on something equally important as sugar elimination. You must eliminate vegetable oils from your diet completely. I'm talking about canola oil, soybean oil, peanut oil, sunflower oil, safflower oil, cottonseed oil. All of them. Gone. Removed from your kitchen. Also eliminate margarine and vegetable shortening. These are toxic to your cells. Here's why this is non-negotiable and why the science is clear. These oils are extremely oxidizing. They're novel to human physiology. They're new. We've only been eating them for about 80 years. Our ancestors ate ancestral fats, the ones that have been part of the human diet for millions of years. Butter from grass-fed cows. Coconut oil. Avocado oil. Olive oil. Lard from pastured pigs. Fish fat. Ghee. These are the fats your body actually knows how to use. They're compatible with your cellular chemistry. Vegetable oils, on the other hand, are extracted using heat and chemical solvents. They're already oxidized before you even consume them. They've been processed at high temperatures. When you then heat them at home, which most people do, they become even more oxidized. The chemical structure breaks down further. Trans fats form. Oxidized compounds accumulate. Then your body tries to use them. It incorporates them into cell membranes. It uses them for signaling molecules. And they create oxidative stress inside your cells. They generate free radicals. They damage mitochondria. Remember, oxidative stress is one of the 4 main mechanisms driving cataract formation. So every time you cook with canola oil or eat food cooked in soybean oil, you're introducing oxidized compounds into your bloodstream. These compounds circulate throughout your body. Your lens cells are bathed in that oxidized fluid. Free radicals attack your lens proteins. Damage accumulates. Over decades, you develop cloudy lenses. The clouding is gradual, but it's inevitable if you keep consuming these oils. Your lens has no defense against this. It has no antioxidant enzymes. It has no repair mechanisms. It can't fight back. So the fix is to switch to ancestral fats exclusively. Cook with butter. Cook with coconut oil. Use lard or tallow for high-heat cooking. These fats are stable. They don't oxidize easily. They won't generate free radicals when heated. Dress salads with olive oil or avocado oil. Use these cold. Don't heat them. Your cells will recognize these fats. Your cell membranes will be built from stable, functional lipids. Your blood vessels will thank you. Your heart will thank you. Your immune system will thank you. And your lens cells will definitely thank you. They'll be bathed in a healthy fluid environment instead of an oxidatively stressed one. I want to transition here to something very important. A question I hear constantly. A question that matters deeply to people who are already starting to see changes in their vision. If I make all these changes, if I stop smoking, if I avoid steroids, if I eliminate sugar and grains, if I switch to ancestral fats, could I actually stop the progression? Could I even reverse some of the damage? Could I get my vision back? That's a profound question. That's what every person with cataracts wants to know. Honestly, the research hasn't specifically studied reversal of established cataracts through diet and lifestyle alone. There are no randomized controlled trials following that pathway. But here's what logic tells us based on cellular physiology. If you stop introducing all sources of oxidative stress, if you eliminate glycation entirely, if you remove the injurious stimuli, then your lens cells get a chance to repair themselves using mechanisms we don't fully understand yet. Cellular repair is real. It happens all the time throughout your body. Skin cells repair damage from sun exposure. Blood vessel cells repair damage from inflammation. Immune cells fix DNA breaks. Why would it be different in your lens? Why would your lens be uniquely incapable of repair? I suspect, and again this is education not medical advice, I suspect that many people with mild cataracts would see stabilization of their vision. No further progression. Some might even see improvement. The key is consistency. You can't follow these tips Monday through Friday and then eat pizza and vegetable oil on weekends. Your lens doesn't distinguish between weekend damage and weekday health. Your lens is accumulating damage continuously. Every single exposure counts. It adds up over time. So the commitment has to be genuine. It has to be consistent. But if you make it, if you stick with it, the potential benefits are enormous. They're worth the effort. They're worth the dietary changes. Let me circle back to where we started with Harold. After we had a detailed discussion about his diet and lifestyle, he realized something eye-opening that troubled him. He was actually eating quite a bit of seed oils. He was using vegetable shortening in cooking at home. His wife was using canola oil for sautéing vegetables. He wasn't smoking, which was good. He'd quit 30 years ago. But he was drinking sugary iced tea every afternoon. 3 glasses. Every single day. Sweetened with regular sugar. That's roughly 360 grams of added sugar per week just from tea. Every single week. For years. Decades, really. Let's do the math. At 78 years old, if he'd been drinking this for 40 years, he'd consumed sugary tea for over 2,000 weeks. He'd been glycating his lens cells continuously. Systematically. Every single afternoon. No wonder his lenses were clouding. We had an honest conversation about what needed to change. I explained the mechanism. I showed him the research. I told him the good news. He could stop further damage. His lens could stabilize. We had him switch to unsweetened tea. We had him eliminate the seed oils entirely from his kitchen. We had him cut out bread and pasta, which he ate regularly. He was resistant at first. He missed certain foods. Iced tea with sugar was a ritual. Pasta had been part of his diet for decades. But his wife, Dorothy, encouraged him. She reminded him of what was at stake. His independence. His ability to drive. His ability to enjoy reading without difficulty. That motivation matters. After 6 months, something remarkable happened. His optometrist noticed something that surprised everyone. The progression of his cataracts had completely stabilized. No further clouding. None. 0 progression. His vision had stopped declining. He could still read the same size print. His glare sensitivity hadn't increased. His lens had stopped getting worse. Now, was this a cure? No. He didn't regain vision he'd already lost. His mild to moderate cataracts didn't disappear. But was it prevention of further damage? Absolutely. Was it stopping disease progression? Completely. And he's the first to tell people about it. He's the first to tell anyone who will listen that consistency beats perfection. He wasn't perfect. He still ate some fruit. He still had occasional indulgences. Maybe a slice of pie at a family dinner. But he was consistent. 90% of the time, he stuck with it. He stayed committed to the core principles. And that 90% commitment was enough to halt the damage. Now, there's one more tip I want to mention, and this one is important for completeness. Avoid alcohol as much as possible. This is less critical than the other 5 tips, but it matters. Research is somewhat limited here compared to other factors, but there's a clear association between excessive alcohol consumption and accelerated cataract progression. Multiple studies show this pattern. Why? Well, alcohol is a known toxin to every cell in your body. It's metabolized to acetaldehyde, which is even more toxic than the alcohol itself. Alcohol generates oxidative stress acutely. It interferes with nutrient absorption. It can raise blood sugar and trigger inflammation. It damages mitochondria. It disrupts signaling pathways. So if you drink alcohol, especially regularly, you're creating conditions favorable to cataract formation. You're bathing your lens cells in a toxic environment. The best approach is to avoid it entirely, or at minimum, keep consumption to rare occasions. If you drink moderately, try moving to abstinence. Your eyes will benefit. Your overall health will benefit. Now let me be very clear about something again. This is education. This is not medical advice. If you're taking medications for any condition, if you have a diagnosis, don't change anything without talking to your doctor first. Your medical team knows your full history. They know your specific situation. They know your comorbidities. I don't. But do bring these ideas to your doctor. Ask them whether reducing sugar might help your vision. Ask them whether switching to ancestral fats could help your cardiovascular health. Ask them about your steroid use if you're on steroids. Ask questions. Be engaged. Be a partner in your own healthcare. Be an advocate for yourself. Because ultimately, your health is your responsibility. Before we wrap up, I want to address something practical. Something real. Something I hear from patients constantly. You might be thinking this sounds like a lot of changes. And I understand that worry. 5 tips. Eliminate smoking. Avoid steroids. Cut out all added sugar. Remove grains and starchy vegetables. Switch from vegetable oils to ancestral fats. Avoid excess alcohol. That's significant. That's substantial. I understand the magnitude of what I'm asking. I get the resistance. People tell me all the time, Dr. Berry, this is too restrictive. This is too difficult. But consider this carefully. Every single one of these changes isn't just about your eyes specifically. These aren't sacrifices just for cataract prevention. These same changes protect your blood vessels throughout your body. They protect your heart from disease. They reduce your risk of stroke dramatically. They reduce your risk of type 2 diabetes. They reduce your risk of cognitive decline, dementia, and Alzheimer's disease. They help with weight management naturally. They reduce inflammation throughout your body. They improve your energy levels. They stabilize your moods. They help you sleep better at night. They improve fertility in both men and women. They enhance athletic performance. They improve digestion. They strengthen your immune system. So you're not making sacrifices for your eyes specifically. You're not limiting yourself just to prevent cataracts. You're investing in your total health. You're investing in clear vision, but also in longevity and vitality across your entire life. You're investing in decades of independence, of being able to drive safely, of being able to read your grandchildren's faces clearly, of enjoying natural beauty without blur, of watching sunsets with perfect clarity. And that's worth the effort, isn't it? Now let me review the mechanism one more time so it's crystal clear. So you understand exactly what's happening in your lens at the cellular level. Your lens is unique among all the tissues in your body. It has no blood vessels. No blood supply whatsoever. It has no nucleus in its cells. That's bizarre and unusual. Most cells have nuclei. Lens cells don't. They lost their nuclei as part of their specialization. It has no mitochondria in the lens cells either. That means it can't generate its own energy. It's completely dependent on receiving energy and nutrients from outside. It's completely dependent on diffusion through the aqueous humor for nutrients and waste removal. That's a critical design feature. And that's why your lens is so vulnerable to blood sugar and oxidative stress. It's isolated. It's dependent. It's sensitive to the chemistry of your blood and the fluid surrounding it. Whatever is circulating in your bloodstream bathes your lens directly. High blood sugar causes glycation of lens proteins. Those proteins get caramelized. They aggregate together. They cloud. They scatter light. High oxidative stress causes oxidation of lens proteins. Free radicals damage the structure. The proteins denature. The lens becomes opaque. Physical damage, radiation, or trauma can denature proteins outright. The structure is destroyed. And some people have genetic predispositions. Some people's lenses are inherently more fragile. But genetics typically accounts for only about 15 to 20% of cataract risk. Maybe 25% in some cases. The other 75 to 85% is modifiable. That's under your control. That's changeable. That's within your power. The 5 interventions I've outlined, if followed consistently, can reduce that modifiable risk dramatically. Research suggests by as much as 87%. Maybe not quite that high in every person. Maybe it's 70% in reality. Maybe it's 62%. But the direction is absolutely clear. Stop damaging your lens, and you won't develop cataracts. How many diseases can you say that about? How many conditions are so thoroughly preventable if you just make consistent lifestyle choices? Not many. Very few, honestly. Heart disease, yes, partially. Type 2 diabetes, yes, absolutely. Certain cancers, yes, many of them. But they're all quite complex. Cataracts are relatively simple by comparison. The mechanism is understood. The prevention is clear. This is one of the most preventable conditions in medicine. Now, I want to address one more thing that I think people get confused about. You might hear that cataracts are part of aging. That's somewhat true in the sense that damage accumulates over time. Lens clouding is a form of aging. But many people age 70, 80, even 90, even 100 years without developing cataracts. Why? Because they didn't damage their lenses. Because they weren't smokers, or they quit early. Because they didn't eat high-sugar diets. Because they weren't exposed to prolonged steroid use. Because they ate real food, ancestral fats, not seed oils. Because they made choices that protected their lens cells. Age isn't a disease. Aging isn't a disease. Damage is the disease. Accumulation of damage is what we call aging. But you can slow that accumulation dramatically. You can slow it so much that you never develop cataracts, even into your 90s. You can die with perfect vision. You can live a full, long life with crystal clear lenses. That's not fantasy. That's not wishful thinking. That's biology. That's what the research shows. That's what cellular physiology predicts. Now, if you do already have cataracts, there's one more consideration. Modern cataract surgery is incredibly effective. Incredibly safe. Ophthalmologists have refined this procedure over many decades. Success rates for vision improvement are in the 95 to 98% range. Complication rates are very low. People often report better vision after cataract surgery than they had in decades. So if you do develop a cataract, surgery is an excellent option. It's not a death sentence. It's not even a major hardship. It's a straightforward procedure. But wouldn't it be better to never need the surgery in the first place? Wouldn't it be better to enjoy crystal clear vision naturally throughout your life? To never have to go under anesthesia? To never have to deal with recovery? To never spend money on surgery? To avoid even the small risk of surgical complications? That's possible. That's within your control. You just have to decide that your health matters enough to make consistent choices. Here's something important to remember. Something I want you to carry with you. Consistency beats perfection every single time. You don't have to be perfect. You can't be perfect. Nobody is perfect. But if you're consistent, if you make these changes 85% of the time, your body will respond. Your lens will respond. Your vision will improve or stabilize. You'll be investing in decades of clear sight. And that's worth showing up for every single day. That's worth the discipline. That's worth the commitment. Let me ask you. Is there someone in your life who's already dealing with cataracts? Is there someone you know who's facing the prospect of surgery? Or someone who's at high risk because of their diet or habits? Share this information with them. Share this video with them. Pass it along to people you care about. Maybe what you've learned today will change their trajectory. Maybe they'll avoid surgery. Maybe they'll maintain their independence and their clear vision for another 20 years. Maybe they'll live their remaining years with the quality of life they deserve, able to see faces, read books, drive safely, enjoy life. That matters. That's meaningful. So pass this along. And if you have questions about anything we've discussed, if you want to know more about the research, if you want to understand the mechanisms better, please leave a comment. I read every single comment. I do. I try to answer as many as I can. And yes, in the show notes below, I've included links to relevant research from Stanford Medicine, Johns Hopkins, Mayo Clinic, and other institutions so you can go deeper if you want to study this yourself. That's education. That's empowerment. You're not just taking my word for it. You're able to review the research yourself. You're able to verify the claims. You're able to think critically. You're able to become an educated consumer of your own health. And that's what I want for you. I want you to be empowered. I want you to understand your body. I want you to make informed decisions. So thank you for spending this time with me. Thank you for caring about your vision. Thank you for being willing to learn and grow. Your health journey matters, and I'm honored to walk it with you. You're not alone in this. Millions of people are waking up to the fact that their health is in their hands. That they have the power to prevent disease. That they have the power to protect their vision. Join that community. Share this information. Talk to your family. Talk to your friends. Be an advocate. Be a voice for clear vision and healthy aging. And most importantly, remember this. Consistency beats perfection every single time. Take care of yourself. I'll see you in the next one.